assessment. Click on IP search bar. Enter IP number and click on search button. Select the patient from the line list. The patient information will be auto-populated. Select Assist by from the drop-down list. Next, date and assessment time will be auto-populated by default. Next, select the check by from the drop-down box. Next, date and visit number will be auto-populated by default. Next, click on subjective and objective. Enter the notes in the text field. Next, click on functional fall risk. Under physical walking, select radio button as independent or require assistant. Next, transfer select radio button as independent or require assistant. Next, fall in the past 12 months. Click radio button as no, yes, specify. We have option, refer to physiotherapist checkbox. Under activities of daily living, bathing ability, select radio button as independent or require assistant. Next, toilet use. Select radio button as independent or require assistant. Under speech and swallowing, speech. Select radio button as normal or abnormal. Next, swallowing. Select radio button as normal or abnormal. We have option refer to physiotherapist checkbox. Under risk element, altered mental state. Select radio button as no or yes, specify. Next, inspired mobility. Select radio button as no or yes, specify. Next, mobility and strength. Select radio button as no or yes, specify. Next, urgencies in urination. Select radio button as no or yes, specify. Next, history of recent fall. Select radio button as no or yes, specify. Next, taking sedate narc antiseptic. Select radio button as no or yes, specify. Next, sleeping problem. Select radio button as no or yes, specify. Click on urine and bowel examination. Under urinary appearance, select radio button as clear, cloud, hematuria, or tea color. Under catheter, select radio button as yes, no, or others, specify. Enter signs and symptoms in the text field. Under vowel, enter vowel pattern in the text field. Enter signs and symptoms in the text field. Click on general examination. Under skin, oral cavity and skin appearance, select radio button as normal, flashed, jaundiced, or pale. Under integrity, select radio button as intact or impaired. Enter signs and symptoms in the text field. Under temperature, select radio button as normal, cold, or warm. Under mouth gums, select radio button as normal, moist, ulcer, coated, thrush. Click on vitals. Under general, enter weight, kg, of the patient in the text field. Enter height, cm, of the patient in the text field. Enter BMI value of the patient in the text field. Enter temperature value of the patient in the text field. Under blood pressure, enter position of the patient in the text field. Enter systolic, mmHg, value of the patient in the text field. Enter diastolic value of the patient in the text field. Enter mean arterial pressure value of the patient in the text field. Under blood sugar, enter fasting value of the patient in the text field. Enter postprandial value of the patient in the text field. Enter random value of the patient in the text field. Under blood pressure, enter SpO2 value of the patient in the text field. Enter pulse heart rate value of the patient in the text field. Click on Save button. Record saved successfully.